Subgluteal sciatic nerve block. Indications, used for surgeries or pain management involving the knee, lower leg, ankle, and foot. Block distribution, sensory block, posterior thigh, lower leg, except medial aspect, foot. Posterior cutaneous nerve of thigh, may or may not be anesthetized. Motor block, hamstrings, all lower leg muscles except those innervated by femoral nerve. Anatomy. The sciatic nerve is the main terminal branch of the sacral plexuses formed by the ventral rami of the L4, S3 nerve roots. These roots begin to merge on the anterior surface of the lateral sacrum and come together to form the sciatic nerve on the anterior surface of the piriformis muscle. Shortly after its formation, the sciatic nerve exits the pelvis through the sciatic foramen, then gives rise to the posterior cutaneous nerve of the thigh, then the nerve descends between the greater trochanter and the ischial tuberosity. Sciatic nerve splits to form the tibial nerve and the common peroneal nerve several centimeters above the popliteal crease. The sciatic nerve also gives off various articular and muscular branches along its course. Probe placement. Place the probe between greater trochanter and ischial tuberosity. The sciatic nerve lies deep to the gluteus maximus and superficial to the quadratus femoris muscle. It appears as a hyperechoic oval or triangular structure. If the nerve is not immediately visible, scan more distally in the thigh looking beneath the gluteus maximus. The nerve should be beneath biceps femoris and semimembranosus/semitendinosus and above adductor magnus. Needle placement. The needle should be inserted in plane from lateral to medial aiming lateral and just deep to the nerve. Adjust the needle position accordingly to get circumferential spread of local anesthetic. Insert the needle a few centimeters away from the edge of the probe to allow for a shallower needle probe angle and better needle visualization. However, if the needle is started too far laterally, the femur can interfere with the needle path to the nerve. A sciatic nerve continuous catheter can be used to provide extended analgesia after surgeries on the knee, lower leg, ankle, and foot. Disadvantages as opposed to the popliteal approach for surgeries below the knee is that there will be some hamstring weakness with the gluteal approach, making ambulation more difficult. This increases the risk for falls. If video was helpful, don't forget to subscribe to Dr. Remy Hakobian's YouTube channel.